Good morning, Senator Michelle. Good morning, Senator Morning, Senator Jeff Stone. I'm Jay Kumar, State Dental Director. I've been asked to provide an overview of our accomplishments and our working relationship with DHCS. Before I came here, there was a list of about 28 tasks to be accomplished. There was a delay because I came on board only in 2015. We have made steady progress with respect to several of those benchmarks. We have completed 15 out of 28 tasks. So our capacity to perform public health functions has increased. We have 5 staff members to help with our goals and objectives. We are working closely with an advisory committee to develop a state oral health plan. This is a roadmap for departments, local health agencies, our partners and stakeholders and others to achieve population health goals and outcomes. We have had several meetings, conference calls, and we have assembled 4 work groups, and we are working with them to develop goals and objectives and strategies for the state oral health plan. We are also working on developing an implementation plan. The oral disease burden document is currently under review. We have a plan to disseminate the document. We are in the process of developing a data surveillance plan to gather current data. So we have obtained 2 federal grants, one from the Health Resources Services Administration, and it's called the California Oral Health Workforce Expansion, which focuses on expanding the virtual dental home model. The other grant focuses on pregnant women and young children. It's called the Perinatal and Infant Oral Health Quality Improvement Project. With respect to our working relationship with the Medi-Cal program and some of the data, CDPH worked closely with DHCS to develop the oral disease burden report and the state oral health plan. We conducted a review of all the reports available in California. In the report, we discussed the prevalence of diseases and risk factors by income, and where data are available by Medicaid status, as well as utilization of dental services. Because children and pregnant women have been identified by our partners as a priority population group, we have focused more on these 2 population groups. DHCS staff is participating in the development of the state oral health plan. We are working with the members of the advisory committee to address Healthy People 2020, those are the national objectives, and there are several specific to oral health. And also we are addressing the Centers for Medicaid and Medicare Services performance measures, along with HRSA Title V block grant measures. So there are several oral health-related performance measures in those documents. With the help of our 4 work groups, we are in the process of identifying strategies to address the burden of oral diseases, as well as utilization of dental services in different population groups. So this work is in progress. With respect to the 1115 waiver renewal application, Medi-Cal's 2020 Dental Transformation Initiative, I've been involved in the various stages of the waiver renewal process. Initially, I provided input into responding to CMS comments regarding the concept. I have participated in meetings with DHCS in discussing the approaches that are now included in the waiver. DHCS consulted with me on various domains in the proposal, and we'll be working together as we move forward with the implementation. So there is a domain that deals with local dental pilot projects. So I'll help them with the evaluation of the applications, and also will assist them in determining what protocols and tools that are needed to implement that domain-specific activities. So I'll provide them with scientific reports or if there is no scientific evidence, we'll bring it to their attention. I'll provide them with best practice reports and any new reports that that will come in the next few months. The subcommittee staff requested a copy of the dental program performance measures. And we are working with DHCS now on the clearance of the measures, and we'll get them to you as soon as possible. So we are working on that one. Thank you.
Thank you. Senator Stone, Senator Monning? Senator Stone?
No.
Nothing, thank you. Well, go ahead, Senator Monning.
Real quickly, I'd just like to offer my welcome aboard, and with respect to your last comment about working on the criteria, you said soon. Any estimated target date for the completion of that?
I don't have a target date yet. Shouldn't be that long. Hopefully, we'll have it soon.
And would that mean in a month or two, or?
It's sub-3, we
Yes.
talk seasons.
Right.
So spring, before the end of spring?
Yes.
Thank you, Madam Chair.
Thank you, thank you. Well, Dr. Kumar, again, welcome. And I would encourage you, we have to figure out how we work collaboratively with you, the legislature, because I did learn on my trip to New York and talking to New York legislators who were so proud of the amazing progress you all had made in New York in terms of improving overall dental health outcomes, that we work collaboratively to figure out how we do move with pretty rapidly now that we have a state dental director. So we want to collaborate.
Thank you.
No question.
We look forward to working with you as well.
Thank you. LAO, Finance, public comment. State your name and the organization you represent.
Thank you. Megan Allred on behalf of the California Dental Association. And we, like you, believe that Dr. Kumar was worth the wait, and we are so appreciative to have him here as the state's dental director. We're also really pleased to be participating on the advisory committee that Dr. Kumar mentioned, developing the state oral health plan, and likewise look forward to the Department of Public Health and DHCS's collaboration on implementing the 1115 waiver to improve oral health outcomes. So we are excited for the year to come, and thank you.
Thank you. Quick question on the advisory committee. Are there legislative representatives, either legislative staff or members on the advisory committee?
No.
Okay.
We are developing a partnership. So.
You might want to consider at least leg staff, just saying. Thank you.
Hi, good morning. Eileen Espejo from Children Now. We also wanted to echo the welcome to Dr. Kumar, and we are also honored to be a part of the advisory committee as well as the Perineal Infant Oral Health Quality Improvement Project. I think I got that right. I wanted to use this opportunity to advocate for restoration of the California Children's Dental Disease Prevention Program. This was a program that had been defunded in 2009 but still exists in statute. It was at $3.2 million, and this is a program that really provided counties with the necessary infrastructure to be able to address and assess the health needs of students in schools that were underserved. And so now with Dr. Kumar's leadership, we'd really look forward to having that program come back and to have him administer the program in a way that it's reaching our underserved students. Just some quick highlights. It did provide both the capacity for counties to develop local oral health coalitions, get to know their provider networks, and also find opportunities to leverage additional federal, local, and private funds. And that's something that's been missing now since 2009. So again, look forward to hopefully having that program come back. The other piece I wanted to touch on real quickly is the 1115 waiver and the local dental pilots. We're hearing from a lot of counties that they'd really like to use some of the pilot money for care coordination. One of the things that we're trying to unearth is the extent to which medical care organizations are fulfilling the contractual requirement to provide services that get children to dental services. And so we're really hoping that once that data is shared somehow, that counties can make some informed decisions on how they might use that local dental pilot money to maybe do some care coordination. Thank you.
Thank you very much. And again, thank you very much. Welcome. It's good to see you. We'll move on to issue number 3, laboratory field services, and the state auditor's report.
Middle seat. Good morning, Madam Chair, members and staff. I'm Dr. Paul Kimsey. I'm a Deputy Director. I'm also the State Public Health Laboratory Director. And I'm here this morning to talk with you about the Laboratory Field Services Audit Report. The information presented in the agenda is quite accurate, and I can move on to the questions if you like.
Please do, thank you.
First question was, please provide an overview of this issue and DPH's corrective actions to address the state auditor's findings. A little history I think will be helpful here. The CSA audit report of September of 2015 was a follow-up audit to one done in 2008 with a number of the same recommendations. In the summer of 2012, when my office was put in charge of administering LFS, we were given direction to prioritize the 2008 audit responses. As a result, 5 of the 9 current recommendations will be fully implemented this year, and 4 of them by June of this year. 4 of them by June this year. CDPH provided CSA with a corrective action plan on December 31st, 2015. A 6-month response on progress is due on the 10th of March, and our responses will be on time next week. I can go through some of the recommendations if you'd like, or, okay. Recommendations number 1, dealing with out-of-state inspections. Number 6, dealing with partnering with accreditation organizations. And number 7, on recruitment, retention, and succession planning are all related to workload. LFS is currently partnering with 1 accrediting organization, has 1 in the final stages of approval, and 1 application more to review. LFS is working internally with CDPH Human Resources on the recruitment and retention issue. Recommendations number 2 on proficiency testing, policy and procedures. Recommendation number 3 on complaints, policy and procedures. And recommendation number 4, sanctioning policy and procedures, will all be fully implemented by June 2016. The 2 longest completion dates are for IT projects and the completion of 7 regulation packages. The IT projects with online facility licensing and data systems are to be completed by July 2018. These IT projects are following the online personnel licensing program, which was transferred and developed by CDPH and went live in September of 2015. Ongoing completion of regulation packages will take place incrementally in the next few years, with a final date for current regulation packages to be completed by January 1st, 2019. And I'll talk more specifically about regulation packages. The second question, are there risks in not having finalized the regulations regarding laboratory personnel? Yes. CDPH works with a legislatively mandated advisory committee called the California Laboratory Technical Advisory Committee, or CLETAC, which meets quarterly and is broadly representative of the regulated laboratory community with 21 members. In fact, our next meeting is tomorrow. Questions regarding this regulation package have arisen over time, and we actually have a draft history, which is pretty dramatic. If you want, I can go into some of the history, but I'll do that at your request. Questions have arisen about this package, and LFS has addressed this with the CLETAC. Recognizing that regulations take 2 to 3 years to implement, LFS sought to formalize the process of disclosing departmental opinions. At the December 2015 CLETAC meeting, the CLETAC approved the use of a subcommittee to be the vehicle to vet these issues. So far, we have received 10 priorities from the CLETAC Regulation Subcommittee. That's a regulation package subcommittee. As an example of the definition, as an example of some of the issues that they feel are of a high priority, one is the definition of supervision and control and issues associated with the use of unlicensed personnel. This regulation package, I think the history might be helpful. As was commented in the agenda, it started in 2008. The department went out in September of 2010 to a 45-day comment period, public comment period, and we received 15,000 comments. So we withdrew the package. In March 2011, we started rewriting the package. We went out for another unofficial pre-notice to the public in December of 2012 and received 300 comments. This package started out in 2010 at about 120 pages. It's now up to over 300 pages. Let me look at something here real quick to be sure I'm accurate. The personal licensing package covers 84 sections, 22 licenses, 10 training licenses. It's a very large, complicated package. With regards to the risks, as part of this interaction with the CLETAC and the subcommittee, LFS is going to be posting questions and answers regarding how LFS enforces regulations on its website. This is one of the issues that we hear about continually. This will provide more clarity on enforcement, but also transparency, uniformity, and fairness, as LFS is the enforcement body and not the interpretive body. An additional risk is the issue of potential personnel shortages in some areas of California. As an example, the genetic scientist category is very much in demand in some areas. Are there questions on this particular regulation package? I can provide the history. It's a lot longer than I outlined.
If you could give us the written documentation, that would be helpful.
We'll do that.
Perfect.
The last question is, what steps has the department taken to expedite the promulgation of regulations related to laboratory personnel licensure and certification? Has CDPH considered sponsoring a bill to modernize this program? Laboratory Field Services gave 2 positions to the Office of Legal Services for attorneys who have been assigned to work on LFS regulation packages. One began work as a dedicated regulations writing attorney for LFS on June 8th, 2015, and the other began working on July 21st, 2015. LFS is working with these attorneys on all outstanding regulation needs. One attorney is currently assisting LFS with editing the personnel licensing regs and writing the initial statement of reasons for that package. OLS and LFS meet twice a week working on this package. And we also have the subcommittee, as I mentioned, from the CLETAC, our industry committee. Another attorney is assigned to various regulation packages, one around proficiency testing, there's a CLIA crosswalk, there's a sperm washing regulation package. In addition, an attorney who serves as LFS House Counsel closely works with LFS on regulations. With regards to the bill, we've had some discussions. At this time, we are not, we are considering, but we are not sponsoring legislation at this time.
I thank you for your presentation. I have to say that the auditor's report was pretty powerful.
I would agree.
And I'm clear that AB 1774, the Bonilla bill, which has been introduced to repeal the laws requiring clinical laboratory to be licensed and inspected by the department, because it deals with this kind of duplication of effort issue between the feds and the state. So that potentially how quickly the bill goes through the process could take that off your plate. But the issue with regard to the laboratory personnel and promulgating those regs continues to be on your plate. And so do you envision a process by which you're trying to roll all the regs out at once? Could they be staggered? What could we do to improve the likelihood that we see some regs in this area before 2099?
Yes, we have in the past and currently talk about this regulation package and the fact that it has grown so large with its complexity. It is actually one of our concerns with regards to a legislative solution, in the sense that it's just sort of passing the buck a little bit. We we're in the regulation process. We think we have a direction, and unfortunately, it still does have that time frame, and we don't know how that can be changed at this point.
Senator Stone?
Thank you, Madam Chair. I kind of echo your comments. The state auditor's report was somewhat critical, and probably justifiably so. Only about half the labs get inspected. Proficiency tests with out-of-state labs is not being done, which creates an uneven playing field. Can you talk about the fees that have been collected? Over 12 million is sitting in your accounts. What is the disposition of those fees? And if they're not being used, why not return them back to the labs that paid them?
Right, and I believe that also relates to the recommendation number 5 about our budget, working with our budget section. We, in our interactions with the auditor, we accepted their interpretation of what had happened. We're researching that. We have our budget section and our Office of Legal Services looking into the specifics. It looks like there may have been some conflict in codes and legislation. We're going to get to the bottom of what happened. And we'll proceed from there. The surplus, some of the surplus we do have plans for with regards to our IT projects and salaries, there are vacancies, there's turnover, quite a few retirements and hiring going on in laboratory field services. But we will have more information basically because of 1774, but we don't have all of that at this time yet.
Okay, so is it fair to say if you do find that there truly is a surplus, that there will be appropriate refunds made to the labs commensurate with those contributions made by those labs in the future?
We would certainly make that a consideration, yes.
Thank you.
Any comment from LAO? Finance? Public comment?
Thank you, Madam Chairman and members. Pardon me. Michael Arnold, representing the California Clinical Laboratory Association. And to follow up on the line of questioning, the Clinical Laboratory Association is concerned. Many years ago, laboratory fees were collected. They sat in an account in laboratory field services, and when we have a budget, and when we had a budget deficit, those monies were swept into the general fund and were expended as a part of the general fund. We worry about a $12 million amount of money sitting in this fund. Also worry because laboratories are now required to report to the department when they have any kind of change in management, and that report of a change in management in a laboratory requires an additional fee of $8,000. And it simply appears, I mean, we're very supportive of the department, but it seems that laboratories are being charged a lot more than they should be charged. So possibly might even want to add some budget control language requiring the department to return any fees to the laboratory industry if they find that they were corrected inappropriately or are not going to be used for the purposes for which they're supposed to be used. One more comment, and that is in the state of New York 4 years ago, the laboratory industry sued the state and got millions of dollars back for laboratories because of overcharging by the state. We certainly don't intend to do that sort of thing, but it is something that I think the legislature ought to do something about. Thank you very much.
Thank you, Mr. Arnold. Dr. Kinsey, would you like to reply to that?
Sure. It's my understanding, and we can certainly get some more specific information, but my understanding about the special fund for the laboratories and funds being moved to the general fund was something that was done quite a bit of period of time ago and was blanking on a good word here. That was made whole at that time, but we can get into more specific detail. I just don't have it off the top of my head.
So it's not something that continues to happen now?
No.
That's in the past?
In the past, yes.
Okay.
Saying it's been replenished?
Well, that's what I have to find out to be sure. But this is, I don't know, Mike, do you remember how many years ago that was?
Yes, I think this was back during the 1990s when we had the budget crises in the 90s, and we did at that time request that the legislature add some language protecting those dollars from being swept in the future. We believe that is still the case, but I don't think any of those dollars were ever returned to the laboratories at the time they were swept. And so, we worry about the future, and it seems to be that, the funds aren't being used for the purpose for which they are being collected, and if they're not going to be used, they should be returned to the laboratories.
We get it. And so we'll follow up in terms of whether or not they were made whole or not, just for our own information. Okay? All right. Thank you very much for your presentation. Appreciate it.
Thank you, madam.
Moving on to, again, within the Department of Public Health, issue number 4, Richmond Laboratory viral. Say it one more time. Rixilus Laboratory Enhanced Upgrade.
Yes.
It's not spelled like you would pronounce it Rixilus, but I'm going to,
That's how the scientists spell it.
then I'm going to follow the scientists, because
Okay.
they would know. Page 17 on the agenda, gentlemen. Welcome.
Good morning. Timothy Bowe. I'm the Chief of Program Support Branch for the Department of Public Health. I'm responsible for the daily maintenance and operation of the Public Health's Richmond Laboratory. This request before you is a request to reappropriate $3.8 million into fiscal year 16-17. This reappropriation is necessary due to the project's delay that were beyond Public Health's and Department of General Services control. To give you a little background, within the Richmond Laboratory campus is the Viral Rixilus Disease Laboratory. We'll just call it VRDL. How's that?
Works for me.
Okay.
You're gonna know it is.
It is certified by the Federal Center for Disease Control as a biosafety level 3 laboratory. In other words, they can test some really nasty stuff. Last fiscal year, this committee approved and we received a $4.3 million capital outlay project to upgrade the VRDL laboratory to meet CDC enhancement requirements for the BSL-3 requirements. After enactment of the budget, we immediately transferred $34,000 to the Department of General Services and engaged them to begin the project. And they started almost immediately. Somewhere around August, there was a lot of forest fires going on. And the state fire marshal suspended all plan reviews and plan checks and redirected all the resources to address California's fire, which made the most sense. As a result, our project, along with any other facilities project, was delayed. And right now, they're back on track, but we experienced about a 3 to 4 month delay in the project. As a result, originally, we were planning to transfer the construction funds about April, May in 2016. With the delays right now, the proposed schedule, the revised schedule is somewhere around August, September. So this is why we're asking for the reappropriation. And I guarantee you, we tried our best not to come back here. So in summary, the project delay was unavoidable, either on public health or the Department of General Services. The upgrades are still necessary, and it's still a mission critical requirement, and we ask for your approval. Thank you.
Got it. Any questions, gentlemen? LAO, Finance, any public comment?
Beautiful. Thank you very much.
That was easy. Thank you. Moving on to issue number 5, timely infectious disease outbreak detection and disease prevention.
Good morning, Madam Chair.
Good
How
morning,
are you?
sir. Fine, thank you.
Senator Monning, Senator Stone, a pleasure to be here. The California Department of Public Health is requesting an investment of $1.6 million in our state public health laboratories and 14 full-time positions. Infectious disease laboratories play 3 unique and critical roles. First, detecting and confirming outbreaks. Second, monitoring and identifying emerging pathogens. And third, providing situational awareness so we can have actionable intelligence and act very quickly to contain those outbreaks. But very importantly, the infectious disease laboratories provide high-quality diagnostic testing for rare diseases, which offers very valuable information to clinicians to actually treat patients and for public health to actually enact control measures. You heard about our effort with Zika virus earlier today, and I think Zika virus is a very good example of the critical role that public health laboratories play. In California today, if you are a pregnant woman who believes may have been exposed to Zika virus and recognizing that many of the Zika infections actually go on, they have no symptoms, you have to have some testing done. And there's no commercial laboratories in California today that can test for Zika virus. That is solely the function of the State Department of Public Health and the CDC. So consequently, we have been working very, very hard to make sure that we have the critical test online to be able to provide that function. So as you heard, we are doing now the genetic testing effective last week. Effective tomorrow, we start doing the testing in-house in our laboratory in Richmond for actually measuring disease in persons that are asymptomatic. So it's very, very important and something that we're very proud about doing in such a short time.
So the 14 cases we heard about earlier, the one pregnant woman case we heard earlier, were detected in either county health departments, I'm assuming, or the State Department of Public Health labs?
Correct. So the way it works, you have a sick individual going, or a worried individual going to a provider. That provider would order some tests. Normally that test goes to a clinical laboratory and gets back to the physician. In some of these emerging pathogens, the test actually goes to the local public health laboratory that then sends it to us. And if we have the capability in Richmond, we do the testing, but if we don't, then we have to ship the specimen to Atlanta to the CDC. And so that obviously has a big delay and something that we like to avoid. And that's why one of the very important reasons of having laboratory capacity in the state is so important, and having capacity that can be really timely so we can provide better patient care and better public health response.
No question.
The other thing that I wanted to point out very quickly is that, we in California have what I call a new normal. I have been doing this job since the year 2002. And when I first came to California from the CDC to be California state epidemiologist, we used to have, one event every so many years. So we would have SARS for a while. That was sort of my first major effort here. Then we started working on West Nile virus infection, and then subsequently we worried about H1N1. And so it was really more sequential. I want to point out to you just last year alone, in 2015, beginning in January, we had a measles outbreak that was pretty massive and that we were very successful in containing quickly. We had already been working on Ebola. We were also concerned about the Middle Eastern Respiratory Syndrome, and we have been tracking that and testing patients in California so that if we have a case, it doesn't spread. We were also working on enterovirus D68 that was leading to acute paralysis in infants. We were working on plague in Yosemite. If you remember, we actually closed parts of Yosemite to treat for plague. We continued to work on West Nile virus and influenza and had many, many foodborne outbreaks that we dealt with. And in every one of those instances, the laboratory is the cornerstone. And so you can imagine when you have that many incidents over a short period of time, the capacity gets exceeded very quickly. And so our request to you today is that you invest a little bit of money in our laboratory so that we can meet the challenges of that new normal in being able to provide these very vital services to the people of the state. And I know there's been some questions and concerns about our ability to hire laboratorians. And my colleague, Drew Johnson, is going to walk you through some of the things we've done to mitigate those concerns.